If you have a back injury or get low back pain as a regular occurrence, then I have 3 key exercises that will help stabilize your spine and strengthen your core. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to take you through 3 exercises for spinal health and core stability. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. So these exercises are known as Dr. McGill's Big 3, who's a back specialist in the United States, and they're used by athletes to strengthen their core to improve their sports performance. But they'll also be beneficial to all of us to help improve the health of our spine, particularly if you get low back pain or spend lots of time sat down. There are many muscles that help stabilize the spine, and the key word here is stabilize. We're not performing these exercises dynamically, like doing sit-ups, but instead focusing on maintaining a neutral spine in a position that engages the core muscles isometrically, which means contracting without moving. If you want to know what a neutral spine is, then check out this short 60-second video up here that explains it, and then come straight back. For each exercise, we'll hold the position for 10 seconds, relax for a moment, and then repeat again. You can do it 3, 4 or 5 times depending on your current core strength and ability before moving on to the next one. You should do all 3 exercises as it will activate the core muscles in a full 360 degrees on the front, side and back of the spine to help maintain a good balance of strength. And you can do these exercises every day if you really want to, but even 2 or 3 times a week will definitely help. The great thing about these exercises is that you can even do them if you have a back condition, as the aim is to maintain a neutral spine. If there is no movement, there will be no mechanical change to the spine to put additional pressure on it, so it makes them safe to perform providing you do them correctly. It's also worth pointing out that if you find the exercise easy and you don't feel challenged, it's likely that you're not performing the exercise in the right way. So try to listen to each of the coaching points given, as some of them are subtle but make a big difference in understanding the position that you need to be in for it to work. If you want to warm up and help mobilize the spine before starting the exercises, then you can go onto all fours and do the cat camel. Start with your hands under your shoulders and your knees under your hips, then drop your belly button to the ground, tilting your pelvis forwards and lifting your head up to look forwards, arching the back into a saucer shape. Then reverse it by rounding off your back, tilting your pelvis backwards, pulling the tummy in and tucking your head down to your chest, creating a dome shape. You then repeat this movement each way for about 10 to 15 repetitions to help mobilize the joints before working on your core muscles. So, after you've completed that mini warm-up, let's dive into the first exercise. We are starting with the curl up, which doesn't look like you're doing much, but it's a great way to activate the muscles on the front. To start with, lie down on your back with one leg straight and the other bent. If you get sciatica on one side, then straighten out that leg. In this position, you'll have a natural arch in your lower back that creates a small gap between your spine and the floor. Using your hands as pressure sensors, you're going to place your hands into this gap to ensure that this part of the spine does not move while conducting the exercise. If you have shoulder mobility problems or this hand position causes shoulder pain, place your hands on your lower abdomen instead. Although not as good, it will still allow you to feel for any unwanted movement. From here, you're ready to activate the muscles. Now imagine someone is about to drop a medicine ball on your stomach and you have to tense all those abdominal muscles to be ready. You can also breathe into the stomach to expand your abdomen to help tense them. You then raise your elbows slightly off the ground to reduce your base of support. At the same time, imagine as though your head is resting on a set of weighing scales. You're going to tuck your chin in and fractionally lift the head so the scales reading reduces to 0, but without moving the neck itself. Think like you're also trying to reduce the pressure of your shoulder blades on the floor. Be sure that you haven't flexed your spine and the gap is still maintained in the lower back, so use your hands to feel that they're not being squashed. And be sure that you don't try to lift your body up. Your focus with all 3 of these exercises is to maintain a neutral spine while activating the muscles around it. So hold it still for 10 seconds in this tense position, relax, and then repeat again. If you need a slight progression to make the exercise harder, you can lift the heel of the foot of the straight leg about 1 centimetre off the floor and hold it still at the same time as the elbows and head are slightly lifted. Again, the importance is to maintain a stable spine while engaging the muscles, so be sure to have a good awareness of your position. The next one is the side plank, which activates the core muscles on the side. This time, lie on your side with your knees and hips bent slightly and bring your elbow directly underneath your shoulder. To avoid any shoulder pain with this one, activate the lats to pull the shoulder down away from the ear. You can also use the other hand, if needed, to press on the shoulder for added support. To avoid sagging and lateral flexion of the spine, which may aggravate your back pain if you have a back condition, move the top hip away from you to square the pelvis up before going into the side plank position. Now you're ready for the exercise. Suck in some air and tense the abdominal muscles as we did with the first exercise, and then by driving your elbow and knee into the ground, raise the hips slightly, but more importantly bring them forwards, activating your glutes until you're in a good alignment from the shoulder to the knee and maintaining that important neutral spine. You will feel the muscles on the underside of the waist activate. Be sure not to raise the hips too high or begin to roll or twist them, as this will bring the spine out of neutral. Hold it still for 10 seconds in this contracted position, then relax and repeat again. After you've done this 3, 4 or 5 times, you can then switch to the opposite side and do the same again, matching the same number of repetitions. If you need to progress this one, then you can straighten the legs with a staggered stance with the top leg foot set slightly forwards and the bottom leg foot set slightly back. This staggered foot setup, rather than a stacked foot setup, will take pressure off the lumbar spine, but the straight legs lengthen the lever so you push through the feet rather than the knees to make the exercise harder. As before, make sure that you're aware of your spinal position at all times during the hold. The last one, and probably the most difficult to perform correctly, is the bird dog, which activates the core muscles on the back. For this one, you need to start on all fours in the same way we did with the CAMEL mobility warm-up. In this exercise, you will end up pushing one arm and opposite leg outwards away from the spine, causing imbalance and forcing the core muscles to activate. However, firstly make sure that your spine is in its neutral position, and remember this should be your focus throughout the exercise, and activate your lat muscles by pulling the shoulders down away from the ears. When you're ready, suck in some air and tighten up the abdomen, then making a fist with your right hand, extend that arm forwards without lifting the shoulder or twisting. At the same time, extend the left leg out behind you, leading with the heel of the foot, pulling the toes backwards, so that the foot is just hovering off the floor. Be sure not to raise the leg up too high, otherwise your spine will go into extension. It should feel like you're pushing the ground away from you with your supporting arm, and in this extended position, the arm, leg and torso should remain solid and stable on the supporting arm and leg. This is activating a lot of muscles, so it's more complex to perform as an exercise and also more demanding on the body. As before, hold it still for 10 seconds, then relax and repeat again. If you can manage to do 3, 4 or 5 repetitions, change to the left arm with the right leg and do the same number of reps on this side. To progress, you can use the sweeping technique, whereby between each repetition you draw your knee and fist in underneath you to touch without moving the spine or rounding the back. Then extend them back out for another 10-second hold. However, if you need to regress this one, as it is much harder to perform correctly, you can just do the arm hold independently, or just do the leg hold on its own, having 3 points of contact on the ground rather than 2. Practice these exercises regularly until you become proficient at being in the right position, and over time you'll see huge improvements with how strong your core feels and how stable your spine is. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below, and share this video with friends to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.